Growing anxiety among foreign medical graduates as NEET PG application deadline approaches. As the clock ticks down to the application deadline for the National Eligibility Cum Entrance Test, NEET PG, the anxiety among foreign medical graduates, FMGs, is palpable. The wait for permanent registrations, PRS, continues, even with the establishment of a new interim medical council in the state, which was meant to bring hope to many FMGs who have been left in limbo. On March 24, the state government announced the formation of a 6-member interim medical council, igniting a flicker of optimism among FMGs. Until that point, they had been told that the absence of a council was one of the main reasons for the delays in issuing PRS. The new council members officially took charge on April 1st, and there was anticipation for a board meeting to select a chairman from among them. However, this meeting has been postponed not once, but twice, leaving many FMGs in a state of uncertainty. With the NEET PG exam date set and the application deadline looming on May 7, the pressure is mounting. Viplav, a hopeful candidate, expressed his frustration: "We cannot apply for the exam without either temporary or permanent registration. Our temporary registration has already expired, and we are still waiting for the PR to be issued." He noted that while the council members have been supportive, they have not provided a clear timeline for when the PRS will be issued. If the PRS are not granted before May 7, many FMGs will be forced to forego the NEET exam. This is particularly concerning for those who completed their one-year internships in May of the previous year, as they faced a similar situation last year when PRS were not issued in time. They were informed that they would need to complete another year of internship to qualify for a PR, a requirement that sparked protests and left the PR process in a state of disarray. The toll of this ongoing uncertainty is significant, with many graduates feeling the weight of lost academic years. "We have already invested 6 years in obtaining a degree equivalent to MBBS from a foreign university. After finishing our internships, we are still waiting for our PRS. When will we finally be able to pursue our postgraduate studies?" Viplav lamented, recalling his journey that began in Kyrgyzstan in 2016. The Andhra Pradesh Medical Council, APMC, has provided various reasons for the delays, initially citing the lack of a council body, then requiring an additional year of internship, and most recently, demanding a new compensatory certificate format. This has left graduates feeling frustrated and confused. The APMC keeps changing the requirements. First, it was about the council, then the internship, and now this new certificate format. "It feels like we are being tossed around without any clear direction," another graduate shared. Recently, the APMC requested graduates to submit new details regarding their online and offline study periods in a specific format. However, many universities have refused to provide this information without an official circular from the National Medical Commission, NMC. In their quest for clarity, graduates have even filed right to information requests, only to find that no such circular exists. If no other state is asking for these details, why is the APMC insisting on it? Viplav questioned, highlighting the inconsistencies in the process. According to the Council, an executive body needs to be formed, and the FMG's issues will be addressed in its first meeting. However, there is still no timeline for when this body will be established. In the meantime, some graduates who recently took the Foreign Medical Graduates examination are considering moving to other states to complete their internships, driven by the uncertainty surrounding PRS in Andhra Pradesh. As the May 7th deadline approaches, the future remains uncertain for many FMGs, who are left wondering when they will finally be able to move forward in their medical careers.